And the reason I've trained 18,000 physicians and healthcare providers, etc., is that it's important for them to understand they may be the canary in the mine. They may be the first warning that something is amiss and that it's an intentional act of water terrorism. So early recognition. We need timely outbreak investigations when something occurs. A physician needs to tell the public health authority, I think something's up. You need to alert them even when they suspect it, not even when they have confirmed disease, but when they suspect disease, for outbreak investigations to occur. Conscientiously reporting their suspicions is extremely important. It's really essential for maintaining water security and safety across the world. And again, the most likely indication that these events are going to occur are going to be these changes in illnesses and disease. So that is an extremely important warning sign for you to remember. Again, an example from the United States, this large cryptosporidiosis outbreak that I mentioned. One of the first indications that thousands of people had been exposed to this particular pathogen was an astute local physician who noticed a lot of diarrhea in his nursing home patients. Thought, this is unusual, there's something amiss here, reported it, and he really was part of the uncovering of one of the largest waterborne disease outbreaks in the United States. So local healthcare providers are critical players in all preparedness for water contamination events and water terrorism. So we know, as I mentioned, these early detection and rapid response technologies are really moving along the line. It's really important that we have all elements on board, right? We need early detection from biosensors and from the water engineers and our water utility folks. We need law enforcement to be telling us if there's something amiss at a water tower. And then we need that early recognition and accurate diagnosis of cases of water-related disease from the medical and public health community to really have an approach in place. So, as I mentioned to you, it really is a challenge. As much as we move toward having water quality and sensing methods, you know, the broad range of the potential agents that could be contaminating the water make it almost impossible to stay ahead, technology to stay ahead of the possibilities. So it really is, in my opinion, still likely that the initial indication of a water terrorism event in a community could still change in illness patterns and the number of patients in the emergency room with profuse diarrhea that no one can figure out what's going on. And also on the other side, if there were radiologic or chemical contamination, again, it may be the healthcare providers that know a cluster of disease and toxicity, and again, in what population? We need to be thinking about the sensitive populations, the little ones, the infants, the children may be the first sign that something is a problem as well. So, made that point that medical providers need to understand their role and that you need to also embrace them as one of your key stakeholders in any planning events or any planning and preparedness for your home country. Another thing that's really important to remember, and is a challenge for Dr. James and I, as you know, when you're planning disaster planning, you're looking for public health protection, it isn't just drinking water that can make you sick, right? There are multiple pathways for human exposure to contaminated water. You can aspirate and breathe in contaminated water, very effective mechanism for having a lot of waterborne disease. You can become ill from dermal absorption in your skin during recovery efforts. Many residents get ill after water contamination by bathing in contaminated water, another effective way, particularly if they have a skin disease, to develop a waterborne disease. They can consume food that's been contaminated with water during food preparation, a huge issue of countries where people are desperate after a water event and will be cooking their food with contaminated water. And of course, again, the link back to food production. If our animals are indirectly contaminated by water that's contaminated, or we get through the food chain, our agricultural practices are affected by this, that can have a massive, massive effect in a community. Another thing that is important to recognize, depending upon the medical training in your particular country, is for those of us that are physicians, it's very difficult sometimes to recognize waterborne disease. It's not such an easy diagnosis to make. So many of the water-related diseases and syndromes that can be associated with a disaster or a terrorism event are very unusual of very unusual diseases that many of us may never have seen in our entire medical career. Many local healthcare providers may be completely unfamiliar with what they're seeing, and it's going to be an extreme departure from the disorders that they see on a daily basis. So again, after Hurricane Katrina, our Centers for Disease Control posted a lot of information about these exotic, unusual diseases that we frequently don't see, to make certain that the local healthcare providers were recognizing illnesses that aren't traditionally illnesses that we see in America. And I've listed some of them here. Now, some of these diseases are common problems in your countries, but again, it depends. Water-related contamination events can create all kinds of issues that we traditionally don't see. So it's important to make sure your medical providers are aware of that when an event occurs. And again, just an example from Katrina. You see that this gentleman is being rescued in the bottom corner. He's fallen in 3 or 4 times. This is an extraordinary case. So not only did he inhale water, swallow water, but had a complete dermal exposure. He'd been in the water for 2 days. So again, multiple exposure pathways. It's messy and difficult sometimes to determine just what this particular gentleman might be susceptible to now that he's rescued. Another important point about this is also on water terrorism specifically. Many of the WMD agents can be very different looking animals when they are ingested. Frequently, physicians across the world have thought about these weapons of mass destruction agents as far as inhalation or perhaps cutaneous exposure. And it's important to recognize that it might be that these agents are delivered through a terrorist attack through water. So it's confusing because many of the illnesses that we are aware of, we're thinking them mostly about how they would the body if they were inhaled or if they were applied to the skin. Now, for water terrorism, using food and water as a mode of dispersing potentially even weaponized agents can really make the diagnosis confusing. It can delay treatment. It can impede public health measures on a timely basis. So again, these are challenges that you need to be aware of as non-clinicians that we face if one of these events would occur. So it's extremely important to remember. We have the list, the classes that one of the other speakers, weapons of mass destruction agents that all of us across the world are worried about. Of the biological agents that we list, 18 of them are water soluble. Of the biotoxins that we worry about, 10 of them are water soluble. Of the chemical agents that we've listed as great concern for a terrorist event, 15 are water soluble. And radiologic agents, depending upon their nature, can be very water soluble. Cesium-137 is a very effective and very water soluble, very, very difficult. And there have actually been some drills in the United States with that being the terrorist threat of Cesium-137 in public drinking water. So it's important to remember again that those agents can be very effectively transported in water. I'm going to briefly just talk about the specific challenges of managing and evaluating water-related disease from chemical agents. One of the other speakers talked about that. We have a tendency to sort of fixate on the biological pathogens, but chemical agents can be extremely difficult and very effective as far as water contamination and create all kinds of challenges for us. And there are a lot of specific medical challenges that are difficult, that are very, very different when it's a chemical agent in the water. And the spectrum, we use hundreds of thousands of chemicals in the world, so the spectrum of the medical disease that a particular chemical can cause can be very broad. Everything from mild symptoms to very severe tissue necrosis to death, depending upon the chemical that would be in water. Now, I want to show you, this is a photo of, these are household waste and orphan containers from one tiny community after Hurricane Katrina. Can you see the massive numbers of chemicals that were in that water and distributed? So the challenge for me as a physician to determine what kind of chemical toxicity you have, there were probably close to 500 to 1,000 bottles of various chemicals, of various chemical mixtures, all in the water. Huge challenge.